What is inflammatory bowel disease? Inflammatory bowel disease, or the short form that's often used as IBD, basically breaks out into two very large groups. There are others, but two major groups. The number one is ulcerative colitis, and it, by its name, colitis, inflammation of the colon, impacts the colon and the rectum. And it is a superficial, or it impacts the top layers of the inside of the colon. Literally, it's ulcerated. The other main disease, Crohn's disease, affects mainly the small bowel. Most of the time, it affects where the small bowel connects to the large bowel. Crohn's disease is different than ulcerative colitis in that the inflammation impacts the whole thickness of the wall of the small bowel. And this inflammation over time can lead to scarring, and scarring can lead to narrowing, and that, of course, can lead to bowel obstruction. Number one, of course, is pain, particularly with Crohn's disease. In terms of other signs, there may be diarrhea, as an example, bleeding per rectum, excessive amounts of mucus, but above all, it's pain and discomfort in the gut. The cause of inflammatory bowel disease can be varied. So to fully understand that, we should just take a quick look at the gut. The gut itself, on the inside, it has a layer of mucin, and that layer of mucin protects the underlying cells from the toxic products from bacteria that grow within the gut. The gut is remarkable. It allows nutrition to go into our bloodstream, but it keeps the poisons out of our bloodstream. Now, some things that can interfere with the barrier will result in inflammatory bowel disease. We know that people who have food intolerances or food allergies are more prone to get inflammatory bowel disease. We also know that inflammatory bowel disease can run into families. So that's probably partially genetic, but it may also have an element of being exposed to the same environmental conditions such as foods. Other things that can interfere with the barrier is an infection, as can be, for example, can happen when you're exposed to pathogens in the drinking water. And it can also be breached if one takes certain medications, such as medications generally called NSAIDs, but things like aspirin and things like ibuprofen. They can all have an impact on the gut, and the breach of the gut barrier that allows various bacterial toxins to get in the gut wall and cause a dramatic inflammation. The dramatic inflammation actually is a protective mechanism that prevents bacteria from invading the body as a whole. If you have inflammatory bowel disease, it's a very serious condition, and certainly you must be managed by a healthcare professional, and that can be your general practitioner or it can be a gastroenterologist. And to treat it, we really do need proper management. The treatment of inflammatory bowel disease typically involves agents that reduce inflammation, and these are very potent agents and must be prescribed and managed by your healthcare professional. And these agents include the biologics, which are typically injectables, oral agents such as 5-ASA or corticosteroids, similarly enemas with corticosteroids. And these agents really do help reduce inflammation, but in and of themselves may not be enough, and there is room, as has been shown in a clinical trial, there's room for adjunctive treatment. So understand that during the process of inflammatory bowel disease, there's a breakdown of the mucin barrier that lines the gut. So it's important to build back that mucin barrier. Now, some of that, of course, will occur as one reduces inflammation. There are also things like N-Acetylglucosamine, which have two modes of action. Inherently, they reduce inflammation, but N-Acetylglucosamine is also a basic building block for mucin. So mucin is about 20% protein, but it's 80% saccharides. And N-Acetylglucosamine makes up 3 out of the 5 saccharides that are absolutely essential for the production of mucin, the recreation of the barrier, and hence the reduction of inflammation in the bowel.